Welcome back to InjuryGuru.com. I am Carla Schimmelpfennig, registered physical therapist, and in this video I'm going to show you an exercise called a stork stand with a knee level reach. Now, don't worry so much about the name. I'll show you the exercise and then you can call it what you want. You can call it what I call it. But this is the 5th exercise in the knee exercise program number 2. As I said, this is a stork stand reaching to the knee, and let me just show you what that looks like. I'm going to show you from the front and from the side. So let's start with the side first. But we said this was a stork stand, so it's standing on that bad leg. Your good leg is bent, foot behind you. And what you're going to do is reach forward and down. So you're going to reach out away from your body at about the knee level. So it looks like this. Now, I want you to reach twice. You're going to reach with your right hand and with your left hand. So let me show you that. Just reaching with my right hand and reaching with my left hand. And when I reach, I'm reaching across my body to the opposite side. Now let me just show you that from the front. Again, reaching with both hands at knee level. So it looks like that. Alright, so I am reaching out as far as I can and down at my knee level. That's why we call it knee level. It's not reaching to my knee. It's reaching down and out at knee level. So, the reason I just want to be specific about this one is I can't be in the room with you while you're doing this exercise to tell you if you're doing it correctly. You can just go by my cues and obviously what it looks like in the video. My patients do have a little bit of a difficult time with this exercise at first. A lot of times I send them home doing this exercise and they come back a few days later, and I usually have to tweak it a little bit to get it to where they're performing that correctly. Now, one variation of this exercise is if you are not very good at standing in that stork stand position yet, then you can do this with your other leg on the ground still. And in that case, I call it more like a lunge. So it's a lunge with a knee reach. And that one looks like this. So you're going to keep your good leg on the ground behind you. I just want your toes touching the ground. And it's still the same kind of reach. Like that. And then let me show you from the front. So my good leg is back behind me. I'm going to reach as far forward as I can and to that knee level. So that's that exercise. When you do this one, I want you to start with 3 sets of 10 repetitions. It's going to feel like a lot. You should feel a lot of work in that hamstring and that quad. And if that's where you're feeling it, that's great. That's what I want. That's what you should be feeling. So start with 3 sets of 10 repetitions. Do this once a day. If you can fit in a second time and you have time during the day, I want you to try this a second time during the day. Make sure that it doesn't cause your typical knee pain. That is really important at this point. We don't want to start doing things that are actually going to irritate that knee. If we are irritating the knee, we're only going to be producing more pain, which is exactly the opposite of what we want.